Hi everybody, welcome to Dr Manny's YouTube workshops. This is part 2 of consequences related to aging, which is the integumentary system, which involves the skin and certain appendages. Okay, the learning objectives for this session are to review age-related physiological changes that occur normally in the integumentary system, the consequences of physiological changes in the integumentary system, and the nursing management for people experiencing physiological changes that occur in the integumentary system as a consequence of aging. Now remember, the integumentary system does include the skin. And the main structures of the integumentary system are the skin, the hair, the nails, the sweat glands, and the sebaceous glands. The major functions of the integumentary system is to protect, regulate body temperature, support sensory receptors, and synthesize vitamin D. Now, it's interesting to note that for every square centimetre of skin, there are 15 sebaceous glands, nearly 1 metre of blood vessels, 100 sweat glands, 3,000 sensory nerve cells, nearly 4 metres of nerves, 25 pressure apparatus points for touch, 2 receptors for cold, 12 receptors for heat, and 300,000 epidermal cells with 10 hairs. Now there are 3 main layers to the skin: the epidermis, dermis, and the hypodermis, which really is not really a dermis, but subcutaneous layer of fat. The epidermis, its function is to protect the tissues of the body from injury. It's made of soft keratin, which is a protein. This keratin is found in the epidermis as flattened cells or dry scales. The outermost layer of the skin, the epidermis, sheds daily with a nuclear layer by the 28th day. It's tightly packed, scale-like cells, and the turnover slows with age. The dermis is connective tissue. It's collagen tissue bands with elastic fibres, with numerous blood vessels, nerve endings, muscles, hair follicles, oil or sebaceous glands, and sweat glands. Also, fat cells. Now the hypodermis, which is the subcutaneous layer, is sometimes called the superficial fascia. It consists of loose connective tissue and contains about 1/2 of the body's stored adipose fat tissue cells. The appendages of the integumentary system are the hair, nails, glands, which include the sweat and sebaceous glands. Hair consists of the root, the shaft, the cuticle layer, the cortex medulla, the follicle itself, the papilla, and an erector pili muscle. The nails, their appearance is important because they actually mirror your health. If you're not well, your nails will not be well. So bluish nail beds, for example, may indicate a circulatory problem. White nail beds may indicate anemia. A dark spot may not necessarily be related to an injury. It may be a melanoma or something related to the heart. Horizontal furrows may indicate a period of illness or malnutrition. Then you've got the sweat glands, which are also referred to as sudoriferous glands, and they're present in large numbers under the arms, palms of the hand, and the soles of the feet. The sebaceous glands, they secrete sebum, and they protect the skin. The sebum is a thick, oily substance and keeps the skin soft and pliable. They're microscopic glands, and they're always located adjacent to a hair follicle. Now, age-related changes that occur with skin, in the 20s, you have high collagen, and the collagen keeps the skin plump and firm, with some dynamic wrinkles only around the eyes and the cheek. This is normal. However, this is when free radicals begin to form. And in the 20s, environmental damage and constant exposure to UV radiation from the sun can take its toll. Cell renewal and turnover rates begin to decline even at age 20. When you get to your 30s, collagen levels are already decreasing by about 1% per year. Wrinkles become deeper and set more prone, they discolor, and environmental damage can be a cause. But essentially in your 30s, you get reduced collagen. And collagen and elastin degrade, resulting in the first of the wrinkles. Cell renewal and degeneration continue to decline, leading to not quite as sharp complexion, and it results in an uneven skin tone. When you get to your 40s, there's volume loss, which makes sagging more noticeable. Wrinkles and skin damage are more visible, and they are harder to treat. The epidermis is thinning. The skin is thinner, and dehydration can be an issue. More prominent signs of skin aging may also appear, such as dark spots, and the skin isn't quite as bright. It's essentially getting duller. In your 50s and 60s, bone and tissue volume shrinks, leaving more loose skin and a hollow appearance. Skin is prone to damage. There's visible volume loss with static wrinkles, which can create a jowly and drooping appearance. You have increased pigmentation, thinner, paler, translucent skin. The protective barrier from the lipid layer, the hypodermis, lessens, leading to less efficiency in retaining moisture and more potential sensitivity and dehydration. The skin is showing wrinkles now, fine lines, and pigmentation. So, the age-related consequences of the skin are weakened facial musculature, loss of subcutaneous tissue around the face and eyes. The consequences, you have creases and lines that appear on the face in the areas of expression. Wrinkles are noticeable on the face. You have frown lines and crow's feet, and ptosis can occur as well. Other age-related consequences are loss of subcutaneous tissue. And as a consequence of loss of subcutaneous tissue, there's less insulation, padding. This can increase skin injuries, there's a potential for hypothermia, and it affects lipophilic medications that you may take. Changes in the connective tissue occur. There's reduced skin strength and elasticity, which becomes worse with UV exposure. The consequences can be solar elastosis or just the term elastosis. There's also sweat gland atrophy. Sweat gland numbers decrease, reducing your ability to perspire. The axilla and the groin area are affected in particular, and the consequences can be hypothermia and heat stroke. Sebaceous glands also decline, producing less oil. Women are affected more than men, especially in the post-menopausal era, and the consequence is xerosis, which is dry, itchy skin. Other age-related consequences are loss of the ability to retain moisture. Skin becomes abnormally dry and scaly, and the consequence again is xerosis, and this contributes to thinning of the skin. Skin becomes dry, may crack, scaly. Other consequences include areas of extra pigmentation, which are found on the hands, the face, the arms, the legs, and most areas exposed to ultraviolet radiation, sunlight, on a regular basis. The consequences are the formation of brown spots called age spots, liver spots, or lentigo senilis. With the loss of subcutaneous tissue, there's decreased number of blood vessels available to supply the skin. Vessels are more fragile and easily injured. There's reduced sensation to touch, pressure, vibration, heat and cold. The consequences are bruising, senilis, purpura, and sometimes cherry angiomas. Other age-related consequences for the skin are seborrheic keratosis, which are referred to as barnacles of aging. Causes unknown, but it occurs with aging. And the consequence are skin tags. A major cause of skin change is ultraviolet radiation or sunlight. And the consequences can be cancer, squamous cell carcinoma, or basal cell carcinoma. Also, malignant melanomas. Loss of subcutaneous fat, a sedentary lifestyle, nutritional deficiencies, comorbidities. The consequences can be pressure injuries such as decubital ulcer, pressure sore, bed sore, a variety of different terms. And this occurs on typically pressure points. Pressure ulcer, bed sore, pressure ulcer injuries. Assessment tools for pressure ulcer prevention are numerous. I've just put this one up here, the Braden Pressure Ulcer Risk Assessment, which now allows you to act to prevent ulcers. The Braden Riskman Scale, where you've got sensory perception being 1, completely limited, very limited, slightly limited, or no impairment. It has moisture, activity, mobility, nutrition, and friction and shear, which is assessed. The highest possible score is 23. The lowest possible score is 6. Mild risk is between 15 and 18, moderate risk 13 to 14, high risk 10 to 12, very high less than 9. But it depends on your organisation, and they will have specific assessment tools available for you to assess pressure ulcer and the prevention. You've also got another scale called the Norton scale, which is simple. It assesses physical condition, mental condition, activity, mobility, incontinence, and it provides you with a total score. Scores of 14 or less rate the patient as at risk. Now, when it comes to the nursing management, the overview essentially will look at prevention as a lifelong process. UV protection, personal protective equipment when outdoors, such as sun hats, lotions, sunglasses, gloves, long clothes, etc. Good nutrition and adequate fluids. Dehydration increases the risk of skin injury. Use of skin moisturizers. Moist skin may heal better as you age. Don't use soaps that are heavily perfumed. Also, it's important for pressure ulcer care and prevention. This comes from caring, knowledgeable health practitioners such as nurses that provide patient and family with education. They have a nursing diagnosis and intervention. They keep the wound clean and dry. They use pressure relieving devices such as pads, mattresses, special beds, and turning and repositioning is very important in conjunction with a nutritious diet. Problems related to aging are that wound healing takes 4 times longer. There will be nutritional deficiencies, stress, medication reactions, comorbidities such as cardiovascular disease, liver disease, diabetes mellitus, obesity, also being immunocompromised. The consequences can result in skin disorders plenty. What are some of the consequences of age relating to hair? Well, it becomes grey or white because it's the follicles that make melanin and they make less as you get older. Facial hair, postmenopausal women may develop it. Hair loss in both men and women, but it seems more acceptable in men and detrimental for women. In relation to nails, there's decreased circulation, which causes the nails to become brittle and thick. Longitudinal lines may appear and growth of nails may be slower. Toenails may become particularly thicker. Let's review. Loss of collagen from the age of 30 plus causes skin to become pale, thin, translucent, or wrinkled. The answer is wrinkled. What age is associated with skin that is pigmented, pale, and translucent? 20, 30, 40, 50 plus. The answer is 50 plus. Which of the following best describes ptosis? Drooping of the lips, drooping of the eyelids, drooping of the eyebrows, drooping of the skin folds. The correct answer is drooping of the eyelids. Loss of subcutaneous tissue may cause which of the following as we age? Hypothermia, malignant thermia, normothermia, or hypothermia? The correct answer is hypothermia. Sweat gland atrophy may cause which of the following as we age? Hypothermia, body odor, elastosis, or xerosis? The correct answer is hypothermia. Which of the following cancers may be caused by ultraviolet radiation as we age? Squamous cell, basal cell, malignant melanoma, or all of the above? The answer is all of the above. Xerosis is an aging condition that results in a decline of sebaceous glands and affects primarily which of the following? Menopausal women, men with a midlife crisis, postmenopausal women, or men with andropause? The correct answer is postmenopausal women. Loss of subcutaneous tissue in the elderly results in bruising of the skin called senilus arcus, senilus dementia, senilus purpura, senilus aqueous. The correct answer is senilus purpura. Okay, in conclusion, everybody gets older. It's inevitable. Getting older has got age-related physical and physiological changes, and getting older, you can have healthier aging. It's achievable. But you have to adopt behaviours and interventions that reduce the risk of developing chronic diseases and prevent further injuries that enhance your lifestyle. Thank you. Check out the other Dr. Manny Learn shops, but before you do, go to the Dr. Manny Learn shop, Consequences of Aging Part 3, and look, if you found these of any benefit, please recommend them to your colleagues, subscribe. The objective is to have people look and learn. Thanks again. See you next time.